Here is a representation of the increase in opioid deaths from 1999 to 2017. In the year 2017, there are over 47,600 deaths, and it will continue to increase. Did you know that in 2017, more than 11 million people misused opioids? What's up, everyone? This is your daily dose of mental health, and in this video, we will be discussing opiate and opioid withdrawal. And before I go any further, please like and subscribe to the channel. The subscribe should be in the lower right-hand corner, and hit that bell icon as well. I cover a variety of topics in regards to mental health, different types of withdrawals, and just mental health in general. So check out all the different playlists, and I even cover my own story of addiction. So I have a playlist in that as well. But before I go any further, I want to read you some stats that I wrote down about opiates and opioids and what it has done throughout the past, decade, 2 to 3 decades at least. Check this out. So, I already told you about the 11 million people that misused prescription opioids in 2017. Another one is every day more than 1,000 people are treated in emergency departments for misusing prescription opioids. In 2017, prescription opioids were involved in more than 35% of all overdose deaths, nearly 17,000 of those deaths. West Virginia is the #1 state of opioid addiction problems leading to heroin. And lastly, the CDC estimates that the total economic burden of prescription opioid misuse in the United States is roughly $78.5 billion a year. Hear that number again. The CDC estimates that the total economic burden of prescription opioid misuse in the United States is $78.5 billion. When I say that again, billion per year. And that's coming, and a lot of that, the tax we pay, some of it goes toward this. So let's go ahead, let's just jump right on into this video on opiate and opioid withdrawal. Here we go. All right, so as you can see right here, can I beat opiate and opioid withdrawal? I wanted to start with some of those facts just to let you know you are not alone in dealing with this dark demon. I've been through it myself. So let me just go into the gist of it. If you're thinking about stopping opiates and opioids, which I have a video on regards to the difference between the two, one's natural and one is synthetic, but there's a lot of variety between where some are considered synthetic and non-synthetic. But anyway, cold turkey. What that would mean if you're trying to quit, you're trying to stop abruptly. Now keep in mind, this is typically one subset of medications when it comes to opiates and opioids besides tramadol, outside of tramadol, meaning things like Percocet, Vicodin. This is the one medication that you can this is the one set of medications that you can technically cold turkey without having a risk of seizures. However, I will inform you that things, depending on how long you've been using, you will go through nausea, vomiting. Right here, biggest one, diarrhea, anxiety, restless leg, chills, high blood pressure. And then I write right here, however, normally you're not at risk, as I said, for seizures or life-threatening events. So can cold turkey be accomplished? Yes. However, still, if you're deciding on trying to cold turkey, still make sure whichever kind of opiate or opioid you are using, that you are not at risk of life-threatening events. In particular, things like, I'll just write here, tramadol. Tramadol is an example of one that can cause seizures, where you would want to taper, which I'll lead into next. Right here, so as we lead into it, tapering, right here. Essentially what a taper is you're slowly, and this is my own definition, you're going to slowly wean yourself off the medication. And this could be anywhere from, there's fast tapers and there's long tapers. A long taper essentially would be, okay, let's say over the next couple months you're going to slowly wean yourself, and then there's quick tapers where over, let's say, like, I want to get this taken care of and do it over a week. Obviously, if you're trying to taper on 1 week, depending on how long you've been using, you're still going to have some of these. Signs and symptoms, and same with if you're doing the long one as well. Also, I want to really bring up the fact of you always want to consult with your doctor if you can. Also, I want to go ahead and address the benefits. The benefits of this, it allows your body to not go through a detox that can cause severe withdrawal symptoms, as I say above, right here. As I mentioned, some of these signs and symptoms of when you do cold turkey. Also, remember, even if the physical withdrawal is not as severe, the mental cravings, pause, can still present. The next video I will be doing will be covering pause, which is post-acute withdrawal syndrome. So essentially, I'll just go into a brief what it is. It is once you get past the first couple weeks of the physical detox, you will start the mental cravings. And for me, at least, that's what's tough, where you have that anxiety, depression, that long-term, that rough, it can be 6 months to a year of just cravings where you're feeling anxious, depressed, even sometimes feeling like, life is worthless. That's just what comes with it, depending on how long you've been using. But in regards to pause, I will tell you right here, it is beatable. If you are willing to put in the work and you are wanting to get clean, you can beat opiate and opioid withdrawal as well as any other drug. If you're trying to get off of it and doing it the right way, you can beat it. That's the whole purpose of this channel, is just to show you that you can beat your own addiction if you're really truthfully wanting to do it. I know everyone has different rock bottoms, but I do encourage everyone to spread the word, let them know about this channel. It's called The Daily Dose of Mental Health. I'm an example of somebody who's been through some shit in my own life, and I've got a whole playlist on it. I'm an RN, I work in psych, so a lot of what I write here, I don't just pull it off the internet, it's what I see. I work on a detox unit, and a lot of the things I'm writing here are things I specifically see on a day-to-day basis. Lastly, I'm sorry I haven't put out a video. It's been a little over a week, but I've worked the last 5 to 7 days in a row. But just to let you know, I will continue to put out videos. I'm shooting for 1 to 2 a week. And the next video I will be covering is pause, which is post-acute withdrawal syndrome, and ways to make it easier when you start that process, things that help me, and things that I've seen that have helped others in the clinical setting. Once again, this is your daily dose of mental health, and I love you all. Peace, love. Remember, hang in there, and you do matter, and don't ever think you can't beat it. Like and subscribe. We'll have the next video coming soon.